Hi, I'm Anthony Carey, San Diego, California with Function First. Welcome to Corrective Exercise number 20. With me is one of our amazing staff members, Wendy Cole's going to help demonstrate one of our favorite exercises that we use sort of as we ascend our corrective exercise programs with our clients. We're going to do what looks like a static lunge or a split squat with the torso flexed forward. We know that when the upper body is forward or the hip is flexed during a lunge exercise, the body does a better job of recruiting the gluteus maximus because of the eccentric demand on that. However, in the corrective exercise environment, a lot of times our clients do not have the ability to eccentrically control the torso at the same time with the spinal extensors, not to mention the length of the sleeve or how that increases the overall demand on the body. So what we're going to do is we're going to modify it for corrective purposes. So we're going to use this bench right here, and what Wendy's going to do with her left foot forward just a few inches from the foot of the bench, she's going to place her hands on the edge. Her right leg is going to be back, and she's going to be slightly weighting her right leg. So we're thinking about 80% left leg, about 20% on her right leg. Very important here, though, is that her torso, from her tailbone to the base of her skull, is going to be parallel to the floor. So she's essentially doing a hip hinge, because there is some engagement of the erectors and paraspinals to keep that spine as a unit working together so that all this movement comes from the hip. And again, we minimize the activity or the stress on the lower back from an eccentric standpoint of what it has to control, and then of course concentrically returning. What Wendy's going to do with the arms here, she's going to use them just to make sure that she maintains this relationship up and down. So she's really not doing a push-up, although with some clients there may be a need to do that. But she's certainly going to control the weight of her upper body, as we mentioned, as she goes through triple flexion on the way down with the ankle, the knee, and the hip. Now the glute really gets involved here. A very strong verbal cue that we can give our clients is driving through the heel. When the weight is forward on the ball of the foot, there's a little bit more anterior shearing force at the knee. We get a little bit more activity of the quadriceps, and which in turn, of course, reduces the ratio of the quad hamstring glute activity during this exercise. So she's going through here, you'll notice she's doing a great job of maintaining this whole structure moving as a unit. She is driving through her heel, and we're really getting the gluteus maximus on the left side engaged. As a progression to this exercise, what we do with some of our clients is this back foot will come off the floor completely, and what we'll see now is that Wendy's going to have obviously 100% of her weight on that left leg with nothing load-bearing on the right. She's still maintaining this good relationship here where she bends the elbows as necessary and really loading through the glutes. And let her put this foot down for a second and take a rest, because one of the modifications we can also do is we can alter the position of the left foot. If we want to create a little bit more hip adduction and control of hip adduction, we can move the foot in. If we want to have a little bit more hip abduction, we can move the foot out relative to the axis of the hip joint. So for example, if Wendy moves her left foot towards me, we know that her base of support now is much more medial to her left hip joint. As she goes down, that's going to activate the lateral glute musculature a little bit more as a modification. And if we want to, of course, do just the opposite, we can move that left foot further from the midline as she goes down, and that reduces the activity of these muscles if that's necessary with something that we want to do. So completely changing that individual base of support will dramatically affect the recruitment of the musculature around that left hip. Obviously, the next further progression to this would be let's get rid of the hands, and then we can do either a split squat or a lunge with an anterior reach. But positioning the hip in this position relative to the torso and making the hip extensors return from hip flexion is a great way from a corrective standpoint to really teach this movement with our clients. Thanks for watching. If you have any questions, feel free to email me at acarey@functionfirst.com. Thanks again.